The individual mandate penalty. The individual mandate penalty has been the most contentious part of the Affordable Care Act. Those opposed to Obamacare felt that the government did not have the constitutional authority to make the citizenry buy something with the threat of paying a penalty. This is the issue that was legally challenged all the way to the Supreme Court. The Supreme Court, in a 5-4 decision, determined that the individual mandate was in essence a tax and fell within the jurisdictional power of Congress to tax those who have a certain level of income but choose to go without health insurance. This is a key part of the legislation because it drives healthy people into the system that might otherwise sit on the sidelines. When there are not enough young and healthy people buying insurance to offset the high costs of the older and unhealthy, you have what's called adverse selection. The result of adverse selection is that the premium costs become higher and higher, and as they do, the fear is that more and more healthy people will drop out, and only those who need it the most, the very unhealthy, stay. This is known as the death spiral in the insurance world. Obamacare eliminates pre-existing conditions on the entry end of the system, allowing unhealthy people into the insurance pool, and so it counterbalances that in 3 primary ways. The federal subsidy, having a limited enrollment period so that you can't just sign up on your way to the hospital when you get hurt or become sick. And number 3, the individual mandate, which requires you to get health insurance or be penalized. The penalty is officially referred to as a shared responsibility payment and not a tax. Beginning in 2014, all U.S. citizens and legal residents will be required to have minimum essential coverage, which are basically Obamacare plans, for themselves and dependents or face a penalty. Those individuals without coverage will pay a penalty, phased in according to the following schedule. In 2014, the penalty is $95 for an individual, or the flat fee of 1% of that individual's taxable income if you make $9,500 a year. It's $325 in 2015, or 2% of your taxable income. The maximum penalty for a family is capped at no more than 300% of the minimum penalty for an individual. So $95 times 3 is $285. Children under 18 years old will be assessed a penalty of 50% of the minimum penalty, which is $47.50. So those are the penalties. What are the exceptions? Well, beginning in January 1st of 2014, all U.S. residents are required to maintain minimum essential coverage unless the individual falls into one of the following exceptions. Individuals with religious or conscious exemption, incarcerated individuals, undocumented aliens, members of Indian tribes, individuals with a coverage gap of less than 3 months, individuals in a hardship situation as defined by the Secretary of the Department of Health and Human Services, individuals with income below the tax filing threshold, which was $9,500 in 2013 and should be around $10,000 for 2014. The most notable exception of the individual mandate rule is that if your health insurance costs you more than 8% of your income, you do not have to pay a penalty. Enforcement. The penalty will be paid as a federal tax liability on income tax returns and is enforced by the Treasury through the IRS. However, unlike typical taxes, individuals that fail to report or fail to pay the penalty will not be subjected to any criminal penalties, garnishments, liens, or levies. In summary, you should now have some understanding of the constitutional controversy of the individual mandate, why it is such an important component of Obamacare, who it applies to, who is exempt, how to calculate it, and how it's enforced.